Welcome, curious minds, to the deep dive. Today, let's kick things off with a surprising thought.
Hmm.
What if something incredibly tiny, something once completely misunderstood, actually held a key to both animal health and maybe even our own well-being?
Hmm.
We're about to explore the sort of hidden world of microscopic threats and the really fascinating journey of scientific discovery that unveiled their true nature.
It's a classic case, really, of science evolving,
Right.
where what we thought we knew was just, the tip of the iceberg.
Yeah.
And it led to this profound shift in how we approach disease. It's really a testament to the power of new tools.
Yeah, I find those stories just so compelling. Today, you and I are taking a deep dive into Mycoplasma suis. Now, this is a hemotropic mycoplasma, and it has pretty significant implications for pig health. It primarily causes anemia, other systemic issues too.
Right.
But as you'll soon hear, its story is, well, it's far more complex than just being a pig disease. Our mission in this deep dive is really to unpack the intricate biology of this organism, explore the surprising ways it affects pigs and maybe potentially humans, understand how it spreads, and discover the strategic challenges in actually managing it.
Yeah.
Get ready for some serious aha moments, I think, about how scientific understanding can dramatically shift our approach to disease.
And our insights today, they come from a stack of detailed sources,
Yeah.
specifically excerpts from Mycoplasma suis, coursing anemia and management, and also Mycoplasma suis, swine anemia and its management. These documents, they really lay out the transformation in our understanding over time.
Okay, so let's unpack this by starting with the shifting identity of this hidden foe, because it really is a story of scientific misdirection, isn't it?
It truly is. For decades, this disease agent was known by a completely different name, Epirythrozoonosus. It was first described way back in 1943 in the U.S., and based purely on its microscopic appearance, it looked like a small epicellular parasite, meaning it was just sitting on the surface of red blood cells.
Yeah.
Got classified as a rickettsia.
Right, a rickettsia. So, for those less familiar, how did that initial classification shape the early understanding and maybe more importantly, the treatments back then?
Well, rickettsia are typically known as these tiny, often rod-shaped bacteria. They're obligate intracellular parasites, often spread by things like ticks or lice. So classifying ECs that way definitely shaped how people thought it behaved and, crucially, how they tried to treat it. But here's where the real twist came. The paradigm shifted, dramatically, around the turn of the 21st century. This was thanks to molecular biology, specifically using 16S ribosomal RNA gene sequencing.
Ah, the molecular tools.
Exactly. That's where the big reveal happened. ECs was not a rickettsia at all. Turns out it was actually closely related to bacteria in the genus Mycoplasma, and that's when the name was officially changed to Mycoplasma suis.
So, beyond just, tidying up the taxonomy in academic papers, why did this reclassification truly matter for understanding and actually approaching the disease on the ground?
Oh, it was a huge light bulb moment for clinicians. You see, as a mycoplasma, this organism fundamentally lacks a peptidoglycan cell wall.
Right.
And that's a critical characteristic because that cell wall is the primary target for a whole major class of common antibiotics, the beta-lactams, think penicillin.
Okay.
So this reclassification immediately clarified why those powerful antibiotics were completely useless against this disease. And it also explained why tetracyclines had historically been the sort of treatment of choice, even if people didn't fully know why they worked better. It explained decades of just clinical observation.
That makes perfect sense. It's like finding out a lock you've been trying to pick with a specific key actually needs, well, a completely different kind of key altogether. So we're talking about a truly unique bacterium here. What else makes Mycoplasma suis so special beyond just lacking that cell wall?
Well, Mycoplasma suis belongs to this group called hemotropic mycoplasmas, or you might hear them called hemoplasmas. They are highly specialized. They're obligate parasites of red blood cells. This strict tropism, this affinity for red blood cells, it defines its entire lifestyle.
Wow.
And it's incredibly tiny, by the way. We're
Yeah.
talking 0.2 to 2.5 micrometers. Plus, it's pleomorphic, meaning it can change shape. Sometimes it looks like a little ball, sometimes a ring, sometimes a rod.
Huh.
And crucially, it's considered uncultivable on artificial cell-free media.
Uncultivable. That sounds like a massive roadblock for research, doesn't it? Especially for something we need to understand and control.
It absolutely is.
Right.
This inability to grow it easily in the lab makes it incredibly difficult to study in detail. And perhaps most importantly, it pretty much precludes the development of traditional bacterium-based vaccines. unlike some other swine mycoplasmas we know about.
Right, no easy vaccine target.
Exactly. Its genome is also quite reduced, very small, which reflects its complete dependence on the host cell for essential nutrients it just can't make on its own anymore. It's truly a minimalist pathogen, in a way.
Okay, so we've established what this organism is, its new identity, some of its unique traits. But understanding that only opens up the next big question. How does something so tiny cause such widespread trouble?
Let's unpack its pathogenesis, how it actually causes disease.
Right.
For years, the thinking was that Mycoplasma suis was only an external parasite, just sticking to the outside of the red blood cell membrane and causing damage from there. But this is where the story gets really interesting, isn't it?
It really does. A groundbreaking discovery back in 2009 completely changed our understanding of its pathogenesis.
Yeah.
Researchers noticed this really striking discrepancy. Acutely ill pigs, they had extremely high bacterial loads when measured by quantitative PCR, qPCR, which we'll talk more about later.
Okay.
But when they looked at blood smears under a microscope the old way, very few organisms were actually visible on the red blood cells. It just didn't add up. So something was missing. Where were they? What was the big discovery?
Well, they were hiding. Researchers found that Mycoplasma suis is actually capable of actively invading its host erythrocyte. They were getting inside the cell.
Inside the red blood cells.
Yes, it's an active process, sort of like endocytosis, where the mycoplasma triggers the red blood cell membrane to fold inwards, basically enveloping the bacterium within an intracellular vacuole. Sometimes it's even found floating freely in the cytoplasm. This completely changed the game.
That is a huge revelation. I can totally see why that would fundamentally change how we think about this pathogen. What are the sort of profound implications of this intracellular invasion?
Well, there are several really critical implications. First, immune evasion. Hiding inside gives the pathogen a protected niche. It's shielded from the host's humoral immune response, things like antibodies, complement proteins that would normally destroy it, and also from those circulating phagocytic cells, the immune cells that basically eat invaders. This is absolutely critical for establishing that chronic, often lifelong carrier state that really characterizes Mycoplasma suis infection.
Right, the hiding helps it stick around.
Exactly. And second, antibiotic efficacy. Being inside the cell significantly hampers antibiotic therapy. Drugs like tetracyclines, even though they're the best we have, might not reach high enough concentrations inside the red blood cell to actually eliminate the pathogen. This explains why treatment often just reduces the clinical signs but fails to completely clear the infection.
Okay, so it's hiding inside the cells, dodging the immune system. How does all this lead to the anemia then? It's clearly not just simple destruction anymore.
You're exactly right. The anemia develops through several complementary mechanisms. Yes, there's direct damage. The physical interaction with the membrane during adhesion and invasion makes the red blood cell more fragile, leading to its premature removal, mainly in the spleen and liver. That's called extravascular hemolysis, and it explains why you see icterus, or jaundice, in affected animals. But it's also immune-mediated. Mycoplasma suis actually alters the surface antigens on the red blood cells. This tricks the immune system into producing autoantibodies against its own cells.
Oh, wow.
Yeah, these opsonized red blood cells, basically marked for destruction by antibodies, are then targeted for removal by the spleen, which severely worsens the anemia. The body attacks itself.
So the body's own immune system is, in a way, kind of contributing to the problem here. Does the organism also impact the pig's internal systems in other, maybe more subtle ways?
Absolutely, and this is critical. Mycoplasma suis is a voracious glucose consumer. It eats up blood sugar. During acute infection, when the bacterial numbers can be astronomical, this rapid consumption can lead to profound, life-threatening hypoglycemia, severely low blood sugar.
Right.
This metabolic crisis is responsible for severe neurological signs, things like weakness, convulsions, even coma, and it can be a direct cause of death, especially in younger pigs. And recent research also suggests it might trigger programmed cell death in the red blood cells themselves, something called eryptosis, which would contribute even more to the anemia.
Wow, so it's not just a blood parasite, it's really a systemic disruptor.
Yeah.
What other systemic disturbances are we talking about beyond just anemia?
Well, beyond anemia, the severe infection involves systemic vascular and hematological issues. You see clinical signs like cyanosis, that's a bluish discoloration, often of the ears and tail, or petechial hemorrhages, tiny little red spots on the skin from bleeding. These point towards widespread damage to blood vessels.
Okay.
And research has shown that Mycoplasma suis actually targets the endothelial cells, the cells that line the blood vessels. This interaction triggers inflammation, changes in the cell structure, leads to widespread damage, and causes red blood cells and platelets to stick to the vessel walls.
That sounds bad.
It is. This endothelial injury is a key trigger for the coagulation cascade, that complex series of events leading to blood clotting. But when it goes haywire, it can lead to something called disseminated intravascular coagulation, or DIC. That's where widespread clotting paradoxically leads to a tendency to bleed uncontrollably throughout the body.
And if all that wasn't enough, I read something about biofilms. That sounds like yet another layer of protection for this pathogen.
Yes, that's a more recent observation, suggesting Mycoplasma suis can form biofilms on the inner surface of blood vessels. Biofilms are these structured communities of bacteria, all encased in a self-produced slimy matrix. It provides a formidable defense against both the host immune system and antimicrobial drugs.
Like a shield.
Pretty much. This formation would serve as a protected reservoir for the bacteria, contributing to those persistent infections and that lifelong carrier state we keep mentioning. It's truly a multi-pronged strategy for survival this thing has.
That's an incredibly complex picture of a truly sneaky pathogen. Now, let's shift gears a bit and talk about how this silent foe spreads. Epidemiology and transmission dynamics are key here. You mentioned Mycoplasma suis is found globally, but its true prevalence is significantly underestimated. Why is that?
Yeah, it's down to a couple of main factors. Firstly, the clinical signs are often really nonspecific. They can easily be mistaken for other common pig problems.
Right.
And secondly, that historical reliance on insensitive diagnostic methods, like looking at blood smears under a microscope, led to a huge rate of false negatives. You just couldn't see it reliably. Older antibody surveys also suggested relatively low prevalence, but that was, well, deceptive.
So the power of modern diagnostics like the PCR you mentioned really changed the game here, giving us a much clearer picture of just how widespread it actually is.
Absolutely. With sensitive molecular diagnostics, especially that quantitative PCR, the qPCR, we now know infection is far more widespread than we ever thought. For instance, one study found Mycoplasma suis DNA in at least one sow on over 76% of the farms they surveyed. That indicates a really high level of endemic infection, especially in breeding herds.
Wow, 76%.
Yeah, and the pathogen is detected in both clinically healthy animals and diseased ones, which really reinforces this concept of a large hidden population of subclinical carriers.
Okay, so it's everywhere, hiding. What are the key ways this organism actually transmits between pigs? How does it get around?
Blood-to-blood contact is really the primary route. And a major way this happens is through what we call iatrogenic transmission, basically. Transmission caused by procedures.
Ah, human intervention.
Exactly. And this is arguably the most significant and, importantly, the most controllable route in modern pig production. It's efficiently transferred by even tiny amounts of contaminated blood. Think about reusing needles when vaccinating multiple pigs, or using the same surgical instruments, castration knives, tail dockers, teeth clippers on different litters without proper cleaning and disinfection in between.
Wow, that sounds like a huge risk factor right there. Those basic hygiene practices can have enormous implications, can't they?
They certainly do. It's critical. Another key route is vector-borne transmission. Blood-sucking insects, things like the hog louse, stable flies, maybe even mosquitoes, they can transmit the infection mechanically. This helps explain why outbreaks often seem to pop up more frequently in warmer months when insect populations are higher.
Makes sense.
Then there's vertical transmission. That's from carrier sows to their piglets, either across the placenta before birth or during the farrowing process. This leads to weak, anemic piglets right from the start, contributes to high pre-weaning mortality, and basically maintains the infection across generations in the herd.
Are there any other ways it spreads that producers need to be aware of? Any less common routes?
Well, direct contact through behaviors like cannibalism or even just licking open wounds could potentially facilitate blood-to-blood contact. Oral transmission seems less certain. Although they found DNA in saliva, urine, and even dust, getting infected by eating it seems less efficient. Parenteral exposure, meaning injection or contamination of broken skin with blood, remains the most efficient and epidemiologically significant way it moves around.
Okay. You mentioned the lifelong carrier state earlier. What does that actually mean for the individual pig and for managing the whole herd? And what typically triggers a subclinical carrier pig to suddenly become clinically ill?
Right, that carrier state is central. Most infected pigs, they establish this lifelong asymptomatic carrier state. And that's thanks to the pathogen's clever immune evasion strategies, hiding inside cells, maybe forming biofilms. These carrier animals are a persistent reservoir of infection on the farm.
Always there, lurking.
Pretty much. And what's fascinating, or maybe frustrating for producers, is that the transition from being a silent carrier to having overt clinical disease is almost always triggered by events that compromise the pig's well-being. Stress is the #1 trigger.
Stress like what?
Oh, things like transport, overcrowding, poor nutrition, sudden temperature changes, mixing groups. Anything that stresses the pig can suppress its immune system, and that allows the latent Mycoplasma suis infection to reactivate and multiply rapidly.
So just like in people, stress can make you sick even if the bug was already there quietly.
Exactly the same principle. And concurrent diseases are another major risk factor. If a pig is already fighting off something else, especially an immunosuppressive pathogen like PRRS virus, porcine circovirus 2, PCV2, or even certain salmonella strains, its defenses are down. That gives M. suis the perfect opportunity to flourish and cause noticeable disease. This explains why the disease often seems to appear sporadically, hitting certain groups or certain times, despite the fact that the infection itself is probably widespread pretty much all the time.
Okay, that makes sense. Now, let's talk about what this disease actually looks like in pigs. The clinical manifestations, you said, can vary widely, from barely noticeable to absolutely devastating.
Yes, exactly. The clinical signs really range from life-threatening acute disease to much more subtle chronic conditions. It all depends on things like the virulence of the particular bacterial strain, the pig's age and immune status, and whether those stressors or other diseases are present.
So what does the acute disease look like? You mentioned it's common in young or stressed pigs. It sounds pretty severe.
It often is. It's typically a sudden onset. Pigs become acutely listless, they go off feed, anorexia, they're weak, and they spike a high fever, sometimes up to 107 degrees Fahrenheit.
Wow.
The most defining feature, though, is severe hemolytic anemia that presents as marked pallor. The skin and mucous membranes look really pale, and as those red blood cells get destroyed faster than the liver can cope, you get icterus, or jaundice, which is that yellow discoloration of the skin and eyes. You'll also see compensatory signs, the pig trying to cope. Rapid breathing, increased heart rate, as the body desperately tries to get enough oxygen around without enough red blood cells.
So beyond just the obvious signs of anemia like pallor and jaundice, what else might a producer or a vet notice in an acute case?
Right, it's not just anemia. Because of that vascular damage we talked about, pigs might show cyanosis, that bluish tint to the ears or tail, and also petechial hemorrhages, those little pinprick bleeds under the skin. And remember that voracious glucose consumption.
The low blood sugar, yeah.
That can lead to profound hypoglycemia, which causes severe neurological signs, convulsions, coma, and can result in sudden death, especially in young piglets. Mortality in uncomplicated outbreaks might be low, but if there are co-infections or a particularly nasty strain, it can be really high. There was one documented severe outbreak where 15,000 pre-weaning piglets died on a single farm over just 8 weeks.
15,000, that's truly devastating, clinically and economically just staggering.
It really is.
Yeah.
And in sows, acute disease can be a reproductive catastrophe. You might see abortions, increased stillbirths, or sows that suddenly stop producing milk right after farrowing. That's echolactia, which then leads to piglet starvation.
Okay, that's the acute dramatic form. But you also mentioned a chronic form, which is probably more common overall and perhaps even more insidious, right? Like a silent drain on production.
Exactly. The chronic form often represents a major hidden economic drain. Pigs with chronic infections are often just described as poor doers. They're unthrifty, their growth rates are poor and variable, they might have a rough or hairy-looking coat, and just a general wasted or stunted appearance.
Subtler signs.
Much subtler. They might appear just slightly pale or have a faint yellowish tinge sometimes. In the breeding herd, this chronic form has major economic importance through reproductive failure, things like sows not cycling and estrus, more returns to service after breeding, lower conception rates, maybe more abortions or stillbirths, and just generally poor lactation quality.
And I imagine this hidden infection could also make them more susceptible to other illnesses. Kind of a compounding problem for producers.
Yes, absolutely. Persistent infection seems to dysregulate the immune system somehow, increasing susceptibility to secondary infections, common things like respiratory bugs or gut pathogens. This often leads to increased medication use just to treat those secondary problems. And in the nursery and grower finisher pigs, It's just a significant drag on production efficiency, poor feed conversion, and you end up with more of those tail-ender pigs that just fail to thrive and never really catch up.
Right, the ones that lag behind. So if you're a vet or a producer out on the farm faced with these varied signs, how do you diagnose such an elusive pathogen? Where do you even begin?
It's tricky. A presumptive diagnosis is often based on putting the pieces together. The clinical signs you see, anemia, pallor, icterus, fever, especially in younger stressed pigs, combined with the epidemiological context, was there a recent stress event? Is it the warmer season? Are there unexplained reproductive issues in this house?
Okay, looking at the whole picture.
Exactly. Postmortem findings can also be supportive. You'd typically see generalized pallor, the blood might look thin and watery, varying degrees of jaundice, and often in a large spleen that's called splenomegaly.
But the real confirmation has to come from the lab, right? And this is where we see that evolution in diagnostics playing out again, from what used to be done to what we can do now.
Precisely. The sample you need is whole blood, ideally collected in a tube with an anticoagulant like EDTA. Historically, the main method was microscopic examination of blood smears. You'd stain the smear and try to actually see the little organisms on the surface of the red blood cells.
Eyes.
But this method is now considered largely obsolete for reliable diagnosis. It just has very low sensitivity. The number of organisms in the blood fluctuates wildly, and critically, those intracellular forms, the ones hiding inside, are not visible on a standard smear. Plus, it has low specificity. It's easy to confuse the tiny dots with artifacts or stained precipitate. So a negative smear means basically nothing. It absolutely does not rule out infection.
Okay, so smears are out for reliable diagnosis. What about serology, looking for antibodies? What's its role?
Serology, often using ELISA tests, detects the host's antibodies against Mycoplasma suis. This tells you if the pig has been exposed in the past. Its utility for diagnosing active disease right now is pretty limited. Historically, these tests weren't very reliable, though they are getting better, but fundamentally they don't differentiate between an active clinical infection causing problems today versus just a past exposure or a subclinical carrier state.
Got it. So if those methods have significant limitations, what is the current gold standard for diagnosis?
Molecular diagnostics, particularly PCR, are definitely the gold standard now. Conventional PCR, or cPCR, can detect the Mycoplasma suis DNA, giving you a qualitative yes-no answer. It's much more sensitive than microscopy. But quantitative PCR, or qPCR, is really the most sensitive, specific, and informative diagnostic tool we have. Not only does it confirm if the DNA is present, but it quantifies the bacterial load, tells you how much is there. This is invaluable for detecting those low-level carriers, and importantly, for correlating the amount of bacteria with the severity of clinical signs. It was qPCR that provided the critical evidence for those intracellular strains, remember, because the bacterial load was super high, but microscopy saw almost nothing.
Right, that makes total sense. That's quite powerful, being able to actually quantify the load. Are there any other promising techniques on the horizon that might make diagnosis easier, maybe faster, for vets working right there on the farm?
Yes, there is something called loop-mediated isothermal amplification, or LAMP. It's an emerging molecular technique. The exciting part is that it offers sensitivity that's comparable to qPCR, but it does not require a sophisticated, expensive thermal cycler machine. It works at a constant temperature. This makes it a very promising candidate for developing rapid, potentially pen-side or in-clinic tests for farm screening in the future.
Okay, something to watch out for. Now, since anemia is such a common clinical sign in pigs from various causes, what other conditions do clinicians have to rule out before landing on Mycoplasma suis? What's the differential diagnosis list look like?
That's a really important point. Because anemia is common, you absolutely have to consider other potential causes. In young piglets, iron deficiency anemia is very common. You need to think about gastrointestinal hemorrhage, maybe from gastric ulcers. Internal parasites like whipworm can cause blood loss. Other hemolytic diseases like leptospirosis need to be considered. Porcine circovirus-associated disease, PCVAD, can certainly involve anemia. And even other systemic bacterial infections, septicemias like Glasser's disease or Streptococcus suis, can sometimes present with anemia. It really highlights the need for a thorough diagnostic workup, not just jumping to conclusions.
Definitely. So, okay, we've got this tricky pathogen. It hides inside cells, causes complex disease. It's hard to diagnose reliably with the old methods. What about comprehensive management and control? It sounds like there's probably no single silver bullet here.
You are absolutely right. There is no silver bullet. Control is really difficult, partly because of the pathogen's biology, remember, no commercial vaccine exists, and partly because of the antibiotic limitations, with it hiding inside cells and potentially forming those protective biofilms. Eradication from a herd is considered nearly impossible. So the focus really has to be on risk mitigation, breaking those transmission cycles we talked about, and preventing the stressors that trigger clinical disease in carriers.
Okay, let's talk about therapeutic intervention first. For pigs that are actually clinically sick, what works best and what are the limitations we need to keep in mind?
For treating clinical cases, antibiotic therapy is the primary approach. Tetracyclines, like oxytetracycline, are the main choice. They're generally effective at reducing those high bacterial loads during an acute episode and helping to resolve the clinical signs like fever and anemia.
There's always a but with this bug, it seems.
There is. The crucial limitation is that while tetracyclines work for acute episodes, they often fail to completely eliminate the organism from the pig. Because it's hiding intracellularly, the drug might not get everywhere it needs to go at a high enough concentration. This leads to the persistence of that lifelong carrier state. So treatment is often more about managing flare-ups rather than achieving a true cure. This means strategic, timed medication, for example. Treating sows before they furrow to reduce transmission to piglets is often a more realistic approach than trying to cure every infected animal.
Right. And supportive care must be important too.
Oh, absolutely critical, especially for severely affected animals. Providing glucose in the drinking water can be life-saving to combat that severe hypoglycemia. And just ensuring a clean, dry, comfortable environment, thermally stable, with easy access to feed and water, is vital for helping them recover.
Okay. So if treatment isn't really a silver bullet for clearing the infection, prevention must be the cornerstone, the most effective long-term strategy. What are the most impactful preventive measures producers can take?
Prevention, focusing on biosecurity and management, is definitely the most effective approach. Vector and parasite control is essential, especially for those blood-sucking arthropods, flies, mosquitoes, lice, particularly in warmer seasons. But maybe the single most critical and controllable aspect is preventing that iatrogenic spread.
The human-caused spread via blood.
Exactly. This means strict adherence to single-use needles. Ideally, a new sterile needle for every individual pig, or at the very, very least, changing needles between every litter.
Not between every pen, but every litter.
Every litter. Minimum. And just as important, all the equipment used for piglet processing, tail dockers, castration knives, ear notchers, teeth clippers, must be thoroughly cleaned and disinfected between each litter. Not just wiped off, properly disinfected. These steps dramatically reduce the transmission of blood between animals.
It's incredible, really, how often the simplest hygiene practices, like just using a fresh needle for every animal, can be the biggest unsung heroes in preventing what turns out to be a massive economic drain and, as we'll discuss, maybe even a zoonotic threat.
They truly are. Simple but critical. Stress reduction is also fundamental. Anything you can do to minimize stress helps prevent those subclinical carriers from breaking with clinical disease. Implementing good all-in all-out AIAO, pig flow, avoiding overcrowding, ensuring proper ventilation and stable temperatures, providing good nutrition, all the basics of good husbandry play a huge role.
And what about bringing new animals onto the farm?
Good point. Limiting the number of source farms for new gilts or boars is important, and implementing strict isolation and acclimation periods for any incoming animals is key to prevent introducing new strains or overwhelming naive animals. Finally, controlling those co-infections we mentioned earlier, like PRRV and PCV2, through effective vaccination and biosecurity programs is vital because they act as major triggers for M. suis outbreaks by suppressing the immune system.
Okay, so if an outbreak does occur despite all these best efforts, what's the recommended herd-level response?
First, isolate and promptly treat the clinically affected pigs with tetracyclines and supportive care. You might need to consider strategic medication of the entire at-risk group, depending on the situation. But crucially, you need to conduct an immediate and thorough review and audit, really, of all the farm's biosecurity and management protocols. Pay super close attention to needle and instrument hygiene practices and vector control measures to identify where the lapse might have occurred. And of course, always confirm the diagnosis using reliable methods like qPCR to make sure you're targeting the right problem.
Makes sense. Finally, let's zoom out a bit to the bigger picture. What are the broader economic impacts and maybe even the human health implications of Mycoplasma suis? It really sounds like it silently erodes profits in a big way.
It absolutely does. Mycoplasma suis causes significant global economic losses, but these are often underestimated precisely because of its insidious, often subclinical nature. There are direct costs, of course, the cost of antimicrobial treatments, the labor involved, and outright mortality, like that devastating 15,000 piglet loss we mentioned. But the most significant economic drain usually comes from the chronic production losses, those hidden costs. This includes things like reduced growth rates and core feed conversion efficiency, which means pigs take longer to reach market weight. It includes reproductive inefficiency in the breeding herd, lower conception rates, more non-productive days for sows, smaller litter sizes, higher pre-weaning mortality due to weak piglets or zoagalaxia. And there are also increased medication costs, not just for MSUS flare-ups, but for all the secondary infections that pop up because of the likely immunosuppression.
So it's not just the obvious losses from dead or very sick pigs, but that constant drag on overall efficiency and productivity.
Exactly. And one challenge is that there's a scarcity of specific, detailed financial models for Mycoplasma suis, unlike for some other major swine pathogens. For instance, Mycoplasma pneumonia, which causes pneumonia, is estimated to cost the U.S. industry somewhere around $375 to $400 million annually. We don't have quite that level of precise data for MSUS. This lack of hard numbers means its true cost. The cost of it silently eroding production margins often gets under-prioritized by the industry compared to more dramatic diseases.
That's a really important point. Now, for perhaps the most intriguing and maybe a bit unsettling implication, the zoonotic potential. Historically, this was seen as purely an animal pathogen, right? But that thinking is starting to change.
Yes, it is. There's accumulating evidence now that suggests zoonotic potential, meaning it could potentially cause infection and disease in humans. This adds a whole critical public health dimension to it. The first suspected human report actually dates back to 1986.
Okay, so it's not brand new, but the evidence is building.
It's exactly. More compelling molecular evidence came from a study conducted in Shanghai, China, more recently. They found a significantly higher prevalence of Mycoplasma suis DNA in swine farm workers compared to a control group of people who didn't work with pigs. This strongly suggests that occupational contact is a risk factor for human exposure or infection. And genetic analysis showed a very close relationship between the MSUS isolates found in pigs and those found in humans from the same geographical region.
Wow. And what would a Mycoplasma suis infection look like in a person? Does it resemble the disease we see in pigs?
Well, the suspected MSUS infections reported in humans have been associated with symptoms like mild fever, hemolytic anemia, and icterus or jaundice. So yes, that clinical picture does seem to mirror the disease we see in pigs, particularly the effects on red blood cells. This potential for zoonotic transmission really elevates the importance of those on-farm control measures beyond just protecting animal health and farm profitability. It reframes Mycoplasma suis control, partly as a matter of occupational health and safety for veterinarians, farm staff, slaughterhouse workers, anyone in close contact with swine. It really demands more of a One Health approach, recognizing the interconnectedness of animal health, human health, and the environment.
What a journey this organism has taken us on. We've gone from thinking it was a misidentified rickettsia to understanding it's this sophisticated mycoplasma that invades host cells, dodges the immune system, guzzles glucose, attacks blood vessels, maybe even forms biofilms.
Yeah.
We've seen how its spread is driven by this hidden carrier state, ignited by stress, and how its economic toll is likely much larger than we often account for. It truly has been a series of aha moments throughout this deep dive.
It really has.
Yeah.
And this deep dive reveals, I think quite clearly, that managing Mycoplasma suis requires a truly holistic approach. You're heavily reliant on proactive biosecurity, meticulous day-to-day management to reduce stress, and strategic, careful use of antibiotics, rather than having a single magic bullet cure. Eradication isn't really the goal here, it's about mitigation and control.
And the scientific journey clear continues. There's obviously a pressing need for maybe a vaccine, despite the challenge of it being uncultivable, or perhaps novel therapeutics that can actually get inside those host cells effectively. We also need faster, reliable pen-side diagnostics, like that LAMP technology, and certainly more robust economic modeling to truly grasp its full impact. But perhaps the most intriguing frontier, as you said, is really understanding its full zoonotic potential. And this raises, I think, an important final question for us to ponder. How does our increasing understanding of these microscopic pathogens in animals continually surprise us, demanding our attention not just for the health of the animals themselves, but increasingly for our own health, too?